Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, two Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment. Our next guest is Dr. Imogen Bexfield, an experienced aesthetic doctor and facial rejuvenation expert with over a decade in advanced injectables and skin health. With a background in dental surgery and a 360-degree approach to aesthetics, Dr. Imogen is known for creating natural, harmonious results that enhance, not change, your unique beauty.
Welcome back to another episode of Breast Intentions, where today we have a very good friend of mine, Dr. Imogen, who is a medical aesthetics doctor down here on the island. Welcome. I'm excited to be here.
We're excited to have you. We have some questions.
So many questions. I was really looking forward to this episode. So let's just dive right into it and have you introduce yourself and a little bit about your journey on how you ended up in Cayman.
Great. So actually, my journey into aesthetics really started at Leeds University. So I graduated as a dentist there. And after that, I had this very sort of prestigious training contract that I did with Guy's and St. Thomas Hospital. I was really excited about this kind of experience and being surrounded by all these experts. Funnily enough, I met someone there who completely changed the course of my life, which is this lady called Dr. L. And she had actually done medicine first and then dentistry second, and she'd ended up on the same training course as me. And she started this program called the London School of Facial Aesthetics, which was this really prestigious academy, and it only taught doctors and dentists. And she said, look, you seem really interested in it. I kept asking her all these questions. She said, why don't you enroll? I will do mates rates for you. Enroll in the course. And I did it. I loved it. And it completely pivoted my career after that. So it meant that after that, I went on and did all these different additional courses. I traveled around Europe, kind of injecting fillers into dead people and all these.
Wait a minute.
Yeah. With all these cadaver courses teaching you how to. They had donated themselves to medical, science. I'm not sure if they knew that it was going to be me putting fillers in their face, but it actually is really good for the safety of medical aesthetics, and it's something I'd encourage all doctors to do.
Okay.
And so I did all these different courses and things and set up White Swan Aesthetics, which is my business in the UK. And that gave me the wealth of experience I needed, all different types of faces and skin types and goals, and some that wanted exaggerated looks, some that wanted subtle looks. And seeing that volume of patients over and over really gave me the tools I needed to become an expert. And so it was after that I then moved to Cayman and slowly transitioned into doing full-time aesthetics. So I call myself a retired dentist now.
Because you were a dentist, you were practicing as a dentist here.
I did, yeah. And really, I thank dentistry for giving me all the tools I needed in terms of manual dexterity and artistry, anatomy knowledge.
Mm-hmm.
I wouldn't be able to do what I did if I didn't have that basis.
I have heard that.
Yeah,
that makes sense.
Before. Yeah.
Yeah, it really, and it kind of sort of transformed my ability to be able to inject and be able to kind of understand the medical needs of people and the safety. So yeah, I wouldn't be able to do what I did without dentistry. And then in 2023, me and my husband started Aventis. I was going to say aesthetics then. It's dentistry and aesthetics.
Yeah.
So he does the cosmetic dentistry. I do the full-time aesthetics. And we've never looked back. We've kind of created the dream clinic that we've always wanted.
It's a lovely clinic as well.
Thank you.
Yeah. Well, a huge part of why we wanted to bring you on to the podcast today is because a big focus of what it is that we talk about is women and midlife and all of the struggles that they go through, and to just not really feel alone. So really looking into a lot of taboo subjects, kind of like what you're bringing up, and debunking them, but also explaining a lot more in depth of what you do and how this can help women and how women don't really need to shy away from let's say, Botox or fillers or lasers and not really be afraid of them. So with that being very similar to what it is that we're doing, how does it impact, or sorry, how does aging impact skin health?
Mhm. To be honest, it does at every single level, from the cellular level, and sadly, from the cellular level to every single layer of the face. Your fat pads that you have will change, the proportion of them will change, the location of them will change. You'll get bony changes within the face. You will get changes in terms of the skin health and the amount of elasticity, the amount of collagen you have in the skin, the amount that the cells turn over. So that reduces. So the skin will look a little duller. So all of these things we can, if you understand them, you can work towards combating them and targeting them. But it's kind of understanding the root of why the changes are happening to be able to address them.
Okay. This was one of the things that we were talking about before you were coming in here today, but it's a lot about collagen. So we have a lot of questions about collagen.
I love collagen.
What role does collagen loss play in aging, and can we actually rebuild it?
Good question.
Mm-hmm.
So yes, we do lose about 1% of our collagen every year from 20 up. So we know that. And we know that we can never replace it completely, but we can certainly stimulate it. And there is an infinite number of ways in which we can stimulate it. And that's probably why people have so many questions about collagen, is because everything in the world seems to stimulate collagen. So what does work?
Yeah.
And how much do you really get with all these different interventions? And there is some evidence base behind lots of different options. For example, if we're thinking about ingestible collagen, we know that a liquid absorbs 80 to 90% compared to 30 to 40% with a powder or a pill. So we know that we're going to get a higher rate of absorption. And we know that we want pure collagen, marine collagen, and collagen that's really similar to what we would naturally have occurring in our bodies.
Okay.
And there is robust evidence to support the fact that within 90 days of taking a liquid collagen, you should get about a 50 to 70% increase in your natural collagen levels, not just the amount, but the organization, which is also important. So we know that looking at the cellular structure before and after taking collagen. But the other thing is, if we don't give ourselves the building blocks in which to retain that collagen, and we don't stop it from being downregulated, then it's not going to stay there. So it's kind of thinking about what we can ingest to be able to create it, and then what interventions we can do clinically to boost it.
So are you saying the powder is not as good? Like, doesn't the powder turn into the liquid? Then it goes...
Depending on the type. Yeah.
Okay.
Depending on the type. So yes. Some of the powders are actually really good quality. And there's a few that I kind of know and recommend. But I would say pills, not so much. We just can't absorb those in the same way.
Yeah.
And it really does come down to the quality when it comes to things like topicals and collagen.
Yes, that was my question. My question was, like, it seems like every moisturizer, every serum is collagen, collagen, collagen. Do they really help? Like, if putting a moisturizer on that says that it boosts collagen or has collagen in it, do they really help just putting them on your face?
So topical collagen doesn't really reach the layer it's supposed to stimulate collagen.
Yeah.
That's the reality of it. It doesn't mean it's necessarily a bad ingredient.
Okay.
But topical collagen, I don't think stimulates actual collagen.
That's what I had heard. So I wanted to see if that was legit.
You really need to go deeper within the skin to the right layer of the skin to be able to stimulate it. And topicals is not going to do that.
So do it from the inside out.
You can do it from the inside out, but you can also do it with treatments as well. So anything that creates a controlled injury to the skin, microneedling, radiofrequency microneedling, PRP, lasers, Profilo, anything that will access a slightly deeper layer, within the dermis of the skin, that's what's going to stimulate your collagen.
So when you think about, when you have people come in and they're sitting in their chair and they're talking about taking collagen powder or collagen pills, so much of that is just coming from marketing then, right? Or even the collagen gummies, those two.
Yes. And also, I try to think encourage people. It's not that it's bad. And actually, if they have loads of a powder or a collagen or a pill collagen that they're using really well, they're remembering to take it because that's half the battle.
Yeah.
They like the taste. And actually, I've looked at the ingredients and it's pure. It hasn't got any nasties in. Fine. It doesn't matter.
Okay.
It's one tiny piece of a bigger puzzle. Would there be a more superior collagen? I've looked at pretty much every collagen on the market and I picked Skin Aid as being one that has the biggest evidence base behind it, the highest rate of absorption, and the most accessory ingredients to support the stabilization of the collagen. But that doesn't mean it's the only one, and it doesn't mean that you can't get benefit from plenty of other versions.
Okay. Next question. Many women say their skin becomes drier, thinner, and more sensitive during perimenopause and menopause. And why does this happen?
So to be honest, the majority of it's actually to do with the estrogen levels. So the estrogen levels plummet, and that then has a knock-on effect on the elastin, the collagen, et cetera, et cetera, et cetera. Just because the skin feels drier doesn't actually mean that it is drier. Sometimes it's more that moisture is leaking out of the skin. So the skin barrier is actually affected by the menopause. So understanding that means that we can target things like the skin barrier with our topicals and build that up rather than having to rely on these thick, heavy moisturizers that menopausal women think that they need. All that's going to do is stop the self-moisturizing of the skin, open the pores up, and actually not really give the skin any extra moisture or benefit. And I think that's a trap that people fall into a lot. They start to have these really thick kind of layers of cream that they pile onto their skin.
Right. To just try to build on top of it and make it. Okay.
Should actually be doing the opposite of what you want.
It can be doing the opposite. And really, you notice that the pores are open. So you'll see in somebody who's got that regime and think, oh, my skin is really dry because, I've hit the menopause, I'm putting heavy moisturizers on, and you look at their skin and you can see their pores really obviously on their skin. And that's because they're doing the wrong skin routine. They're not focusing on building up the skin barrier and they're focusing on trying to patch up the problem.
I see.
Oh, okay.
Yeah.
You have a lot of questions. Okay, so let's go to skincare ingredients then, and must-haves for women in their 40s, 50s, and beyond.
So, retinol is the holy grail, or retinoic acid is the holy grail of topical skincare, no matter what your age. The formulation, the percentage, and I guess the amount even changes as you age. And most people find that the biggest barrier to retinol is the dryness that it creates. And they think to themselves, oh, my skin's already dry, and now I'm making it drier with retinol. That's not really what's happening. We're coming back to your point about the estrogen changing the cell turnover. Retinoic acid is going to speed up the cell turnover. So you are going to start to counteract those effects that the low estrogen is having. So even though your skin feels drier, it's turning over more effectively. It's improving the skin barrier. And in the long run, it's going to add hydration to the skin and not diminish it.
Okay, so I have a question about this. Yeah, because I really actually... I don't think that I was educated properly on using retinol. And I was in the hairdressers the other day, and I guess I just took it upon myself to use the retinol.
Did you go rogue?
Well,
Then for retinol map,
someone told me. So I did like 5 days in a row, and then I leave it for the rest of the month. And then she was like, oh, no, do it like 2 times a week. And, just
that's what I've heard. Build up and like start slow.
So there's a magic formula.
Okay.
The magic formula is 3 times a week. Anything less, and the half-life of the retinol means that you'll never get used to it. Anything more than that, it's going to be too aggressive to start. 3 times a week consistently. You definitely don't want to do feast and famine. So, 5 days straight and then nothing at all. Because again, as soon as you come back to it, you'll have that same effect of really intense and really severe again.
Yeah. So then if you're doing it 3 times a week, and maybe this is where, this is where this all came from, is like, are you not constantly peeling all the time?
So there's a few tricks and tips to be able to get around that. So there are some formulations of retinol that are made to not make you peel. That's the last resort. That's the one that
The peel one is the last resort.
The non-peel.
The non-peel. Oh, okay.
The non-peel one is that I only really recommend that if I've tried everything else and they can't get over it.
Okay.
Just because retinoic acid always makes you peel, really. And that's what's going to penetrate to the deeper level of the skin. And we need to see peeling as good. Ooh, peeling. Yay.
It's not pretty when you put your foundation on and it's like,
But you know what is pretty? That beautiful fresh skin that emerges like a calcifly.
but I guess the thing is that if you're doing it every 3 days, when do you actually have that opportunity for your skin to look fresh and not peeling?
So
Skin gets used to it.
yeah, your skin gets used to it.
okay.
You can also put a small amount of moisturizer on 5 minutes before to pre-prep the skin.
Okay.
Then you put your retinol on, your retinoic acid on. Use a very, very small pea, which in time becomes a bigger pea. And you can also start with a lower concentration, so a lower percentage. So you do all of those little things first, and then gradually your skin should get used to it. You should be able to build up, build up, build up.
Okay.
Last resort is the non-peel. If all else fails.
And that would be because your skin is very sensitive and you don't like the way that the retinol is.
Or you can't push through.
Okay.
You know, it's like, and that's fine.
Yeah.
Like, we're not in skincare army camp.
Yeah.
I do understand that not everyone is committed to the cause. So, if that's really so, if you don't want to push through those stages of peeling, then fine. We can give you a nice retinol that's still medical grade that isn't going to make you peel.
Okay. Oh, wow.
And the moisturizer you're
wrong.
putting on beforehand, is
Mhm.
that a vitamin E, or is that what I heard?
You
does it
can.
matter?
You actually can. You just want to make sure that it's still something that's not too thick, because again, we don't want to undo the effect of
Yeah.
the retinol, and the retinol is going to unclog the pores and minimize the pores and reduce the oil production. We don't want to be counteracting that.
Okay.
I was making some big mistakes.
I don't think you're the only one.
Okay, good. Okay, so speaking of worst skincare mistakes,
It's a good segue.
what are also some skincare mistakes that women do that actually accelerate aging?
So I'm not sure if it accelerates aging, but I feel that the majority of the people that come through my door are not in an optimized skincare routine.
Okay.
And they're focusing on, oh, I've got this cream and this spray and this oil. And then really there's nothing active in the routine. Or if there is something active, it's not at a high enough percentage to do anything. And I always say to clients, with the right medical grade routine, this is actually like a full-on treatment. So we take our 3D camera, we look at every layer of the skin, we identify areas of their concern, like pores or lines, wrinkles, pigmentation, sun damage, etc. And then in 3 months, we retake that 3D camera. It is like they've had laser treatments. The skin is completely different. Texture, sort of smoothness of the skin, lines, wrinkles, everything. It's completely different skin. And the only thing that they've done is have an optimized skin routine. And that doesn't mean a crazy amount of products. It means a small number of the right products for your skin.
Mm-hmm.
Yeah.
Now, moving on to Botox, would you say that that's like Botox and fillers is your specialty or one of the main?
Definitely. I mean, I would say my specialty, or what I prefer to do the most, is the full face transformations.
Okay.
So I probably do maybe 5 to 10 a week of really amazing, multifaceted cases. So combining things like Botox for the active lines, filler for the volume loss, some kind of skin booster or Profilo, lasers, skin creams, thread lifts. And that way, not only do you actually end up with a more natural result because you're considering every aspect of the face and facial harmony, but you get that wow, refreshed transformation.
Mm-hmm. Okay, so with Botox and fillers kind of being this one that is quite common and talked about a lot, can you break both of them down and just explain both of them, what they do, how they impact the skin?
That's actually a really easy one because fillers replace volume.
Okay.
And Botox stops the active movement that causes creasing.
Mm.
So in general, you can almost think, and this isn't completely accurate, but you can almost think of Botox upper face, fillers lower face. It's not quite like that, but that's just a general rule because we do have lots of areas of Botox that we can use to tighten the neck or to tighten the lower face. But the majority of people, 70% of people, will have Botox for their frown, forehead, and eyes.
Mm-hmm.
And then they'll have fillers, lower face for a little bit of lip.
Cheeks, lips. Yeah, okay. Fillers do get a bad rep, though.
Yes.
Yep.
Poor things are so unjustified. They're so misunderstood.
I guess it's the people that overuse them,
Yeah.
right? And so what would you say are the right ways to use it to enhance natural beauty? That may be a loaded question because everyone's different, but
not really, because, fillers are a really small but important piece of that puzzle. And aesthetics is a puzzle that you have to put together. And if you are only focused on fillers, it's never going to look natural. Imagine, it's the same with Botox. If you do Botox on somebody for 20 years and you never think about their skin and you never think about the lower half of their face, doesn't matter how beautiful and soft your Botox is, when they get to 60, they look weird. And it's the same with fillers. If you are relying solely on fillers to create your transformation, and you're not considering other aspects, 100% it's going to look overdone. And also, if you aim for 100%, I always tell clients we aim for 50 to 70% improvement. And that's enough to make you have good bang for your buck and good value for money and refreshed and feel good about yourself. But also, it's not too much that it looks unnatural. That's the sweet spot.
okay. So can we get into a more personal thing?
Yes.
Do people ask you this? Where do you have fillers?
I do actually. I have a little bit of filler in my cheeks, but in my kind of treatment portfolio at my age, which is 34, I'm skewed more towards regenerative treatments and less towards filler. But that balance slowly shifts as time goes on. So yes, I'm still going to be focused on regeneration. Everybody should be. But as I start to lose volume in the temples, as I start to lose more volume around the jawline, yes, I'm going to need to rely on fillers more than I do now.
And I think it's one of the great things too, is because you have such a natural, like beautiful face.
Coming back.
We'll be waiting. But do people ask you a lot?
Yes.
If you have,
and I'm always really open because I think, I don't know, I think sometimes women are really fearful about opening up about the types of treatments that they've had done. That the way I see it is, when I was at university and I would speak to my friends about whether they'd revised for an exam, I'd always say, yes, I revised really hard and I got an A because I revised really hard. I'm not some genius that can naturally, get an A without having to study. Some people would say, oh, no, I just picked up. I didn't study at all. I just.
Oh, right.
And there's name is true.
Yeah.
And it's the same with aesthetics. Oh, no. I've just used a really magical face cream. I would never say that because I wouldn't want women to have an unrealistic view of what it takes
exactly.
to put my face together.
Yeah.
At the same time, I do totally appreciate that it's a small island and not everybody wants to share everything and this is my job.
Yeah.
But that's why I'm open, because I don't want to be other people to be under any pretenses that I just wake up like this.
Yep. I agree. 100%. Yeah. I do notice, like, I have had filler in the past. At the cheeks I've had. And this is my question I want to ask Imogen, is that I'm noticing like it feels like my face is melting. Oh, that's what I noticed so much, is that like, I guess the sagging, the jowl kind of lines. Would that be then the filler in the cheeks to potentially lift that up?
So to an extent. So you only ever create lifting to the point that's anatomically normal, which comes back to that point that we were making about 50 to 70% improvement.
Right.
So yes, we get some lifting from the cheek area. So if I can see that the cheek area is unsupported and deficient, first I'm going to replace that. Let's get those cheeks anatomically where they should be.
Okay.
And then let's work down. And if it's not lifted enough, I'm certainly not going to say, let's pump you with more filler.
Right.
I'm going to say, let's look at other options to be able to create a lifting effect. And that's how those pieces of the puzzle come together in the right way.
Right. Okay.
So
I did that it was years ago now. I didn't really, story that I've told several many times now.
Oh, I haven't heard that.
I'll tell the story. I got it done, and I felt like I got a lot done at the time. And a week, maybe 3 days later, a friend of mine came to visit from another country, and I hadn't seen her in about 6 months. And I think I was on my phone, so I was kind of looking down where you get a bit of that saggingness. And she said to me, you know what, she didn't know that I had just gotten filler. She said, you know what you should do? You should get some of those thread lifts put in. And the whole time I was like, I don't have filler. And I haven't seen her for 6 months. And she's now telling me that I should get something else done. I was like, I spent so much money. Not money well spent. So since then, I think I've been kind of turned off and not necessarily wanting to go back and do that again.
Yeah, and I think going back and doing the same thing again, I mean, that wouldn't make any sense. But I think maybe the issue is more with the expectations of this is the only treatment I need, and I'm going to do loads of this, and this is going to give me the result I want.
Right.
Where it's probably needed to be a bit more of a multifaceted approach. Thinking about things like, oh, why don't we do a little bit of filler, but also a little bit of a thread lift, and also consider some skin tightening, you know, that more harmonious approach.
Yes. Okay.
So don't be put off.
No, I mean, and I've like, I did feel, I mean, I haven't done anything in years now. And I've been okay with that. But I think now I'm kind of, the more I look at myself in the mirror, the more I'm not loving it. So I do think it's kind of time to maybe revisit. It's that, and also the eyes. Like I've noticed over the past even 6 to 8 months, like I've noticed my under eye just looking very different than it ever has.
Is it the hollow?
Yeah.
Okay. Yeah, I've had a lot of people talk to me about that.
Yeah, and I never, like I
contracts.
was never concerned about circles under my eyes or having dark eyes or.
So is that something to do with aging?
Oh, 100%.
Okay.
100%. You lose the bone in that area, and you lose that you create a little tear trough. And that will trap the light and make it look dark.
Yeah.
And also the volume loss makes more creasing on top. Under eyes are a really tricky, next and under eye are really tricky because there's multiple things going on, and there's no muscle underneath the eye that we can target with Botox. I wish there was. It would make my life really easy.
But I've also heard people say, like, don't put filler under your eye, you'll end up regretting it, or I've heard these types of things too.
If it's not done correctly. The under eye is one of the most challenging areas to treat clinically. And one of the most important aspects is the depth in which you place this filler. It's the type of filler that you use and the depth in which you place it. And the type of filler must be filler that's specifically designed for the under eye. And my favorite is called Redensity 2. And it's really difficult to access actually because you can't get it in the US. But it's one of the few fillers available that has the properties required to be able to create the beautiful smooth results underneath the eye that last. And the depth in which you place it is so important. If you don't place it deep enough, then you're going to get lumps and bumps. And it's actually really challenging. You have to kind of feel and navigate your way through the different layers and practice how that tissue feels as you move through it to know if you're in the right place.
Right.
Sorry, that's getting a little gory. I mean, there's a few people fainting on the other end of the polynucleotides. Just healing over.
I was actually telling her the story yesterday because we did the Light Up the Night breast cancer walk, and my mom was there, and you had met my mom because I had to come in to get my filler topped up. And I have filler in my temples and then in the cheeks. And I couldn't see it, but my mom could see the needle. She was like, just freaked her out.
She was in the cheerleading chair.
Yes. Yeah. Right. But that was the one time that I had, actually, sorry, I came to you quite a few times. And I'm like, I think I need Botox because something's going on with like, right here, my face is looking really narrow. No, I need Botox. You just gave me Botox. And then she finally got to a point where she's like, darling, you really need some filler in your temple.
Like it's time.
Yes. Is that another popular area as we age that women might need?
The temples is a really big area. And it's an often overlooked area. And I think overlooked by patients themselves and then also overlooked by practitioners because we lose that bony volume in the temple. It gets very hollow.
Yeah.
But if you look at the structure of an older person, they are hollow in the temple and wider at the bottom. They're this inverse triangle. And we have to change that triangle to the triangle of youth, which is thinner at the bottom and wider at the top. And so by changing that ratio, it actually will give that overall more youthful face shape.
And it is not one that you would ever notice
Yeah.
either.
Ever.
Yeah.
Yeah.
But
Like from,
very subtle.
yeah. Because you know how when people have that thought about filler and it's, and I did, I even researched every photo and I was looking at the before and afters of people that were getting filler in their temples because I just didn't know how different I was going to look when I was coming out of there. And I didn't
Yeah.
it helps take the shape of your face. And I think you were saying that you can start to lose your eyebrows when you get
They
a
kind
photo
of cut
taken.
off.
Hmm.
So you end up just having a very short eyebrow.
Yeah, so that's why I kept on going in to get Botox because I wanted her eyebrows lifted. And she's like, that's not it. No.
No amount of Botox is going to do that.
Okay, so then how long does Botox last and how long does fillers last?
So Botox is between 3 and 5 months. Ideally, the consistency of the Botox is really key because if you let it get to 80% run out and then repeat it, the muscle stays nice and soft. And it actually means that it ends up lasting longer. If you let the muscle get back to full force, imagine like a bicep at the gym that you've worked at, it's ginormous. It's going to be really hard to shut that muscle off compared to one that's really sweet and small and quiet.
Right.
Yeah.
Fillers, they range anywhere between 4 months and 2 years, really. Depending on the type. So you've got the real structural filler that you can use to create lifting in temples and jawline. Then you've got the really soft filler for texture, like the lip area. Or you've got something like the under eye filler, which actually lasts a remarkable amount of time, 18 months to 2 years.
Oh, no way. Oh,
It's
wow.
thin, but long lasting. It's pretty magical, actually. Yeah.
Okay, so then last question about Botox and fillers is what are some side effects that people need to be aware of?
So I always try and categorize the side effects into things that happen commonly and are relatively minor, but still important to know, but relatively minor. And they would be things like bruising, redness, discomfort. Then you've got the things that are a little bit more unusual, but a little bit more significant. Things like infection and delayed hypersensitivity. So during COVID, we had a lot of interaction between the COVID vaccine and filler. And that's not something we had ever encountered before. So this was kind of new territory. But I had seen something like that happen before. If you see enough people, you're going to see enough things.
Yeah, right.
Where people had been unwell and it had made their filler go really, really hard. And that's what I saw during COVID. And so I approached it in the same way and just dissolved it. Because once it goes hard like that and encapsulated, there's no other option. And thank goodness with filler, I don't know why people are more scared about filler than they are Botox because it's completely reversible. So if we have an issue like that with delayed hypersensitivity, okay, it's not pleasant, you have to have your fillers dissolved, but it doesn't mean that you're left with lumps and bumps that you don't want. And then you've got the most significant of all, which is vascular occlusion. So that means if you inject filler into a blood vessel, it can stop the blood supply to that area. And that is every practitioner's worst nightmare. But again, if you do enough injections, you are going to see it, you're going to encounter it. And if you manage it correctly, it doesn't have to be a significant outcome. If you recognize it straight away, it's no problem. You just dissolve it, move on.
Yeah, that's the one that you really have to you as a patient have to pay attention. And if you do notice something right away, to get into seeing
Yes, but your practitioner should notice it.
Oh, it'll happen that quick.
I think I've had 2 in my career.
Mine one.
Sorry?
Was mine one? When I had the hematoma.
Oh, no.
No, that's not.
No, I don't think.
This is, no. Bruising's
Quite common.
Even more, so I would say probably within bruising, maybe 1 out of every 50 would be like bad. You'd be like, ugh, bad. Sorry, but, it's just, sorry, not sorry, it happens. But with vascular occlusion, you have injected the filler into a blood vessel.
Okay.
Turns white.
It goes white. And if in the 2 that I've had, I've seen straight away. I just dissolved it.
I didn't realize it was that fast. Like I thought you go home and then you might see it turn white.
You see signs straight away. If you haven't seen it before, it can be tricky to pick it up, and that's when there's an issue.
Oh, I see.
But if you've seen them, like it's quite obvious, and you can check how quickly the tissues refill.
Okay.
And you do your protocol, dissolve it, and not an issue.
Mm-hmm.
Not fun, but not an issue.
But it can be like if, say, not you, but if another practitioner didn't notice it. You went home, didn't do anything about it. Like, this is where you could damage skin tissue and lose.
100%.
Yeah.
Yeah.
It's very serious.
Yes, that's the most serious complication with fillers is vascular occlusion. Mm-hmm.
Okay.
Yeah.
Wow.
But very rare. I mean,
Rare,
in your case.
Rare, and also a lot of it will come. You cannot eliminate 100% of the risk with technique, but you can know the high risk areas. You can know the anatomy.
Okay.
You can know your injection technique, and you can use specific techniques like cannulas in high risk zones. So you can mitigate the risks with the right product and the right experience and the right technique, but you can never eliminate the risk.
So you also offer laser treatments and skin rejuvenation.
That's correct.
We want to get into that a little bit.
Yeah.
How do laser treatments work, and what types of skin concerns can they help with?
So I actually think lasers are probably the most confusing aspect of aesthetics, probably on par with skincare. And the reason for that is because there are a million different types of lasers, and there's also a confusion between the brand name of the laser versus the technology of the laser. So, each different type of laser has its own fancy name, but you have to drill down and understand, well, what wavelength is that? To really understand what am I treating with that wavelength, or what am I resurfacing? So when it comes to thinking about different conditions, anything skin related pretty much you can treat with a laser.
Oh my gosh.
Pigmentation, sun damage of vessels, scarring, anti-aging, tightening, lines, wrinkles, texture, pretty much anything. It is, in my opinion, probably the single best way to improve the skin. Not the only way.
Yes.
Mhm.
Okay.
But if you pick the right laser for the right skin condition, it is the sort of top option.
Do you have a ton of lasers? Like ton of different types?
Yeah, we do actually. So we have resurfacing lasers like the Halo, which would be, I guess, a more modern version of CO2. That's the kind of equivalent.
Oh, is that what it is? Okay.
And then we have BBL, which again is the kind of more modern version of IPL, which would be for your classic kind of sun damage and redness issues. But the difference with BBL is there's been a lot of studies by Stanford University where they've looked at the effects at a cellular level of BBL, and they found that it actually changes the DNA within the skin cells. So it's considered a regenerative laser as opposed to just visually improving things.
Oh, okay.
Mm-hmm. But we also have skin tightening lasers. What else do we have? We have hair removal lasers, actually. We didn't tend to use that very often because we kind of focus more on the medical side, but we do have it.
Good to know.
No, there's just so many. It feels like there's so many, and they're
Very confusing.
so it's a little bit confusing. But I guess that's why anybody would book an appointment with you to chat about what is the best course of action.
Right. And sort of coming back to the point of understanding the technology, there's really only a few technologies when you drill down that each laser is going to fall into. And so it's a light-based technology like IPL, BBL. Then you've got an ultrasound technology, which would be things like Morpheus. Then you've got something like the radiofrequency microneedling, which again would be more of a thermal. It's microneedling, but it's got that thermal tightening element to it. And then you've got resurfacing, which would be your halos, your CO2s, your ablative, just destroying lasers. Yes.
And they would all have different downtime.
All have different downtime. Yeah.
Okay. Because that's another thing I think that, at least for me, is daunting about it. Like, I don't want to laser my face off and then have to leave the house for 3 days. Because I probably can't do that.
Yeah.
But they wouldn't all be like that.
No, and I think, with lasers like CO2 or like Halo, that's a once a year jobby.
Yes.
And once you see, there are only certain things that you can treat with that. So you have to make the decision. Do I want to improve this or do I not? Because no amount of peels or microneedling is going to create that result.
Yeah.
So you decide, do I want to accept this level of results?
Yeah.
Or do I want to go for the big guns and accept the consequences?
Yeah. Yes. The 3 days in the house.
About to fly.
Right. Okay. So yes, can you tell us about the difference between, say, microneedling, PRP, radio frequency treatments those are the ones that are for collagen boosting, would you say?
So I've that and many more.
Okay.
When it comes to the regenerative treatments or the treatments dedicated to skin condition, it's like a little ladder. And you start at the bottom with your topical ingredients, and then you work up, microneedlings, peels, radiofrequency microneedling, PRP, and then you move up into your ablative lasers, etc., etc. And more intense or higher up the ladder doesn't necessarily mean better, because each of them are doing different things and targeting different improvements to the skin. But thinking specifically about the ones you mentioned, PRP harnesses the regenerative effect of plasma. So it's got growth factors within your plasma. So you take your blood out, you centrifuge it, you create this beautiful golden plasma that we all love that has these amazing regenerative properties. And then what you do with that plasma, the world is your oyster. You can use it as filler. You can use it for microneedling.
You can?
Yes.
I didn't know that.
Yes, you can. So that's
I think I mostly heard about it with the microneedling, and then it basically gets put back into your skin.
Yeah.
And it's your own body, like it's from your own body.
Exactly.
So it feels safe. So I think I'm hearing a lot about it lately. Like I feel like there's kind of a resurgence.
Yeah,
I don't know what word I'm looking for.
Anything regenerative at the moment is popular. Where everybody wants to come in and they want to steer slightly away from fillers and more towards regenerative treatments. But it's my job to just make sure that I steer them slightly back to the areas, that need it.
Because just because we've seen it on social media doesn't mean that that's what is the best choice for us.
Exactly. And it doesn't, if somebody comes in and they have really hollow temples, again, you're not going to be able to even if you use the PRP as filler, you're not going to be able to create the volume that's required to give you the results. So coming back to the PRP, you normally get between 5 to 6 mils of plasma as long as the patient's pre-prepped and they're hydrated and they've had a really good healthy diet. And so you only need maybe 1 mil of that for microneedling. So a lot of the time it'll just get thrown away. But I said, ooh, what else can we do with this beautiful plasma? And so we can use it for filler. We can do it for little bits of mesotherapy. We can use it down the neck area. Why waste it when we have it? However, in terms of results-wise, it's still going to be a more superficial treatment. So when you're thinking about the radiofrequency microneedling, because you've got the thermal element to it, it'll actually go deeper down into the dermis and create more of a tightening effect. So tightening would be more radiofrequency microneedling. PRP would be more superficial or kind of fillers, like texture of the skin. And there was another one you asked me about. Was it normal microneedling?
Yep.
So normal microneedling, it depends what you're microneedling into the skin. So there's the one element of it that's creating that controlled injury, which stimulates that collagen. But the second element is, what are you microneedling in? And at the moment, our big thing is exosomes.
Yes.
So
they are.
If you know about exosomes?
I'll let you explain it, but I have that, like I would say in the past, again, 4 to 6 months, I've been hearing more and more and more about these. That's the new thing.
Yeah, they are. So I went to a conference about a year ago in the US, and the big topic of the conference was exosomes. And they had about 50 different companies and 50 different talks all on exosomes. But I'm going to dedicate these 3 days to demystify exosomes for myself so I can understand what the best exosome is, why it works, and whether to use it or not. And what they are is that they're little vesicles that tell the stem cells what to do. So we used to think that injecting stem cells into an area was the be-all and end-all for regeneration. But it's actually the little messengers that inform those stem cells is what's creating the change. And those are the exosomes. So at the moment, we're not allowed to do anything IV with exosomes, but we can microneedle them in. And in some places you can inject them, but I don't think we're allowed to inject them here. And the most important thing when it comes to exosomes is they must be human derived. So the ones that I have are from the umbilical cord and the main beam.
Okay.
And we want them to be young. So if we're getting exosomes from blood, from an adult sort of platelets, then what's that person done with their life? They've probably been drinking and smoking and God knows what else, eating processed meats and things that are going to ruin the quality of our exosomes. The baby has done nothing. Do we know we've got these beautiful, fresh, vibrant exosomes that are going to give us the maximum amount of regeneration?
I have not heard about this. Surprise, surprise, but I have not heard about this.
Mm-hmm.
Okay.
And you can use it topically.
That's what I was going to say. I feel like there's like serums and stuff that you can get to that are...
Yeah, we have a beautiful exosome serum, actually. It's super popular. And again, it's from the umbilical cord of a baby.
It's crazy. So crazy. I love it.
And actually, so I would say probably this is 2024 really, the two biggest things of 2024 were exosomes and polynucleotides. And again, polynucleotides are regenerative and they come from the sperm of a salmon.
So out of we did about salmon sperm favorite for the show. But what's it so fancy term?
Disgusting things in 2024 that were piling onto our face.
It's easy.
So what would you call... You wouldn't call it a salmon sperm facial. You would call it...
So, I mean, it's actually injectable. So, I mean, the technical name is polynucleotides. May I answer better? Like, do you know what this is? Do you want to?
Don't know, don't care. Yeah.
It works, though.
All right. That's the question.
So, yeah, they're probably, and coming back to the under eyes, actually, they're a really popular option for the under eyes, for regeneration of the under eyes.
Ah, okay.
Wow. Okay.
So what kind of downtime are we looking at for things like microneedling or PRP?
So microneedling PRP, very little.
Okay.
A couple of days, maybe a little bit pink, nothing wild. If you're doing it to treat scarring, which I tend not to because you really can't reach the base of the scar with microneedling.
Yeah.
Doesn't mean it doesn't help with the superficial scarring, but I think it's better to just go big or go home with scarring, like acne scarring, and do more of a laser option. But if you did that, there might be, 3-4 days, but normally very, very little.
Yeah. I had skin cancer. So I had Mohs surgery on my nose.
Amazing.
And had the CO2 laser.
Amazing.
I want to say two or three. I can't remember now. 2 or 3 treatments after. And you can barely even tell now. It's amazing. Yeah. It's amazing. So for me, I didn't have any downtime. I mean, it was a very small area. I can imagine it would be different if you're doing much more area of your face. But yeah, I went back to work. I think it was I noticed that it was pink, but nobody else really noticed.
Yeah, I mean, that's the thing with downtime. It is variable.
Right.
No matter what you do, whether it's a laser, whether it's microneedling, whatever it is variable. You can have a non-peel peel. So, a peel that doesn't even peel.
Right.
All right. And, or you can, even with the deepest halo laser, you can turn those settings down. It's fully customizable. It's like a, sports car. You can just tootle it around the drive, or you can like really rev it up and take it around the racetrack.
Right.
And it's going to have a completely different outcome in terms of results and also in terms of downtime.
Okay. And the person.
Yeah.
For women worried about pigmentation, sun damage, or age spots, what would be the best treatment?
In general, it would be a combination between topicals and lasers. Depending on the type of pigmentation. The only pigmentation that's a little harder to treat would be melasma. So that's a hormonal pigmentation. It's still triggered by heat and light and sun, but it's usually hormonal in derivative. So it would be if someone's had a baby or going through any kind of hormonal changes, the pill, all of those types of things can trigger it. And obviously there's 2 elements to that. If the hormonal trigger hasn't been resolved, you can treat the melasma, but it's going to come right back. Or if the person can't control their exposure to heat and sun, again, the melasma is going to come back. However, if we can control those things, the halo laser can treat melasma beautifully. So we can put you on a whole program of topicals, but sometimes it's even ingestible options as well, and lasers. And it doesn't mean we can get rid of the melasma, but we can control it to the point that the skin looks good.
Yeah.
Yes, but traditional sun damage and pigmentation, still the BBL laser is the most beautiful choice. Even with one treatment, you can make such a significant improvement. All those little blemishes, or people call them age spots, sunspots, all those types of pigmentation will come off beautifully. And again, you can maintain them with topical creams.
Otherwise, you're just going to end up back in the chair again.
Well, I mean, I talk to people a lot about their sun control.
Yeah.
I spent half my life talking about the sun and showing people pictures to try and scare them. Look at this person who had sun. Look what happened to them. I actually do that because there's a picture of a lorry driver who had sun on one half of his face for like 20 years, and I pull it up because he never got burnt, and it's not that he got red, and people think, oh, if I don't burn, if I just tan, or if I don't put sunscreen on, but I'm not changing color, then the UV is not affecting me.
Yeah.
And I show them the photo because that was the same with this guy. And all that UV builds up over the years. And then it changes not just the condition of the skin, but the laxity. So he's sagging on the one side. And you look at that photo and you think, why on earth would you not protect yourself?
Right.
You can see the visual and safety issues.
Right.
Yep.
Yeah.
So we talked about retinol. Are there other ingredients that women should be prioritizing in their skincare routines?
Definitely. But I think my one bugbear with skincare is that I think, women go into a shop or even sometimes into a clinic and they buy things that they think are good ingredients, but they're really inappropriate for their skin type. And sometimes they'll be on something that will be really good. I say, stop that. It's really not the right option for your skin. Or even somebody who's on a really good quality, gentle cleanser and gentle moisturizer. And actually what they should be on is some salicylic to tighten up the skin, to reduce the pores. Or maybe they should be on a vitamin C cleanser, which is going to be more of an antioxidant effect because they've got some redness in the skin. So what is good for one person is really not good for the next.
Yeah.
And there are some universally good ingredients like alpha hydroxy acids and retinols and vitamin C's, but it's not universal across the board or in what concentration or proportion they should be using them.
Okay. Yeah, good advice. What role does diet and hydration play in skin health? And are there certain foods that promote healthier skin?
So this is a really good question, actually, because I think it's kind of touching on what I think is the future of aesthetics, which is longevity medicine and regenerative medicine. And I'm doing a lot of research. I'm not there yet, but I'm doing a lot of research at the moment to really educate myself in terms of what interventions we can do diet-wise and supplement-wise to improve cellular health and longevity, and therefore also skin health. So, for example, your things like your salvestrols. I don't know if you've heard any salvestrols. Salvestrols, they're naturally occurring in berries, but we know that they are great anti-cancer, great antioxidant. And as we have, I guess, processed our vegetables and fruits more and more and more, and they've become less and less organic, the proportion of these salvestrols has diminished. And so ideally, you would take something like a supplement or have all organic berries that you could get these kinds of things from.
I see.
So yeah, anything processed obviously is going to have an impact on the skin. Anything natural and organic. You want your vegetables to be as stressed as possible. You want them to have a tough life. You want them to suffer and struggle and not be assisted, because that way they have a much higher salvestrols.
It's such a great way to write it. And like assisted would be with like pesticides and go what's unassisted vegetable.
Right.
We need them to fend for themselves and survive. It's a tough world out there, vegetables.
Such a good word.
Yeah, very good. Yeah. Yeah, we don't want to, give them
an easy life, no? They're just so on the plate that, lazy vegetables.
I love it.
But yeah, I mean, I have a whole list of supplements that I'm kind of exploring at the moment. Things like NAD, things like alpha lipoic
Yes,
acid.
NAD is another big one I've been hearing. I mean, I have been hearing about that one for years, but I think even, again, the past few months, 6 months maybe, a lot of NAD talk out there.
Yeah. Yeah, and we are, this is the beginning of this exploration into longevity medicine. We don't know everything yet. And we know that NAD improves the mitochondrial health of the cells. And again, that's throughout the body. But we still don't know. There is no magic formulation of exactly which of these supplements we should be taking and when and in what proportion. We're all figuring it out. And so we're using regular testing of ourselves and patients to find out how our biological age and how our cell health is improving as we do these interventions to figure out what is the optimized kind of proportion of these things we should be taking for us and not for the next person. So we're going into more personalized medicine as opposed to what is generically good in your diet, what is good for you, what controls your sugar levels, what makes your sugar levels spike, because that's a huge one for skin health. We do not want sugar to be spiking our and damaging our skin cells and spiking in our blood.
Yeah. Many women feel pressure to look young forever. How do you help clients focus on aging gracefully or pro-aging rather than chasing perfection?
So I think this is a tricky one, actually, because there's so much to this. There's very, very few people that I see and treat that I feel have any kind of dysmorphia. Because the reality of the society that we live in puts an emphasis on the way that we look. And so in a way, you do have to embrace that a little bit. And I suppose I spend a long time during the consultation really trying to come to the root of the cause. Why does that person feel the way that they feel? And also, is it realistic and justified? So I think what I don't like about aesthetics is I don't like practitioners imposing their view of beauty and aesthetics and perfection on their clients. And that can go both ways, because if you come in and see me and you're really bothered by a little line or wrinkle and I diminish you and I poo-poo you and I say, oh, actually, like, what are you talking about? You're young, you don't need this, without having really explored why they feel that way. Again, I'm putting my view of what would bother me onto you. This is what bothers you. So I think there is that element that you can try and want to treat so naturally that you're diminishing someone's kind of point of view. And then there's the other extreme as well, where people want to be more overdone than is natural. And I spend a long time with those people too, and try to understand the vision that they're looking for. And if the vision that they are looking for is overdone and is more than I would like, who cares? It's not my face. I have to guide them and teach them that this might not look the most youthful. This might not look the most natural. But if that's the look they are going for, it's like clothes. I wouldn't tell somebody else how to dress. I might say, oh, I like this more than that. But I certainly wouldn't say somebody looks bad just because they don't have my vision of beauty. So I will support them to achieve that safely and guide them along the way and see if I can influence them a little bit along the way. But everybody should be empowered to achieve their vision of beauty with a little bit of guidance.
If a woman is feeling self-conscious about aging, what's one thing she could do to maybe feel more confident?
Yeah, I mean, I still think skin.
Yeah.
I still think it comes down to skin. I think my goal for everyone, and it's not always their goal, but I always think it's a great goal, is to feel confident makeup free. And the majority of that actually comes down to the skin. So I think when there are lots of clients on a budget, and that's totally fine, and we can stage treatment and we can start with one focus. And I think you can never go wrong with starting with the skin, because it always looks 100% natural. It's always preventative. So I know I'm giving that patient benefit now, but I'm giving them benefit for the future. So I go away feeling good about myself. I'm like, I've done right by you.
Yeah.
You want to spend some amount of money. You're on a limited budget, but I've done you a good service because, I'm giving you that long-term benefit that I know is going to keep you in good stead for the future.
We have a segment called Hot Flash or Hot Take. So hot flash is not great. We don't want them. And hot take is the good. So I'm going to go
hot take or
hot take. A hot take. Yeah.
Okay.
So I'm going to go through a list and ask you if these things are a hot flash or a hot take.
Okay, got
it. Okay. So facial massages, gua sha, lymphatic drainage.
We're putting you on the spot.
Am I only allowed to just say one word?
No, you can go into detail.
Expand on it.
So I mean, I would probably say hot flash. There is some evidence that they create a bit of microcirculation and some lymphatic drainage. But in reality, that's really not what's making you look old in the majority of cases. That's not the issue.
Yeah.
They certainly, understanding lifting and aging, they're not going to lift.
Okay. Yeah, so don't expect these extreme results. Okay. Pulling a Pamela Anderson and going makeupless.
I mean, I think that's a win.
It's a hot take. A hot take, yeah.
And again, I'm sure that she will have done things to work on her skin. We're 100%. Yeah. So it's not that she's not doing anything. She's just on the veering towards the more natural side. I love that.
Right.
If somebody comes in and they say, I don't want to do any Botox and fillers, totally fine with that. We can come up with the most beautiful treatment plan for you that focuses on skin health and, injectables that aren't, that are completely natural, et cetera, et cetera. And I think she looks great.
Mm-hmm.
Mm-hmm. Yeah.
Yeah, it's great. It's great to see.
Yeah.
I'd love to see more of it.
Yeah, 100%.
So speaking of Botox, I've been seeing a lot. I do follow quite a bit of influencers who do beauty and facialness. Facialness. I've been seeing a lot of them saying that they're trying to not do Botox, trying to get away from Botox, and instead they're using taping, face taping. So at night when they go to bed, several times a week, they use tape to like tape their face in certain positions in an effort to not have to do Botox. Is face taping
Hot
a hot flash or a hot take? Okay.
I think it's a hot flash because when you're sleeping, actually, the majority of the time you're not expressing anyway.
Yeah, right.
So it's not a complete hot flash because if you can, we've known for a long time, if you can sleep on your back and therefore not on your side, you're not going to be getting the sleep lines and the creasing. And so yes, it's not completely useless. It is certainly not going to counteract the effect of Botox. So if you are comparing taping with Botox, you can't.
Okay.
Because the times when you are expressing is during the day.
Yeah.
What are you going to do? Walk around with tape?
Right. So, right. And it's like Botox is relaxing the muscles.
Yes.
So
it's like taping. Botox is like taping, but you can't walk around with the tape.
Yeah.
So it's not a realistic option.
Okay. How about Botox or fillers strictly for prevention?
So fillers don't prevent. They only replace volume. So they don't give you any future benefit. That's one of the big negatives about filler.
Okay.
Botox does prevent. And there have been some really good long-term studies on twins showing that long-term Botox use in identical twins creates more lifting of the neck area, of the face area, obviously more smoothness. So even when the Botox runs out, so if they've been doing Botox for 10 years and then they tell both twins, right, 6 months, no Botox, the twin that has used the Botox for 20 years will look 10 years younger. So we know that there is a preventative.
Okay. So hot take.
Hot take.
At-home skincare devices like the LED masks, microcurrent tools, dermaplaning.
Yes. So with the LED mask, if it's not a professional level mask, you're really not going to get the results. So the red wavelength is fantastic to build collagen, but it relies on two things. It relies on the strength of the LED and it relies on consistency. And patients will start off using it 3 to 5 times a week and then taper off because then it's actually a lot.
Yeah, it is.
Because it's a commitment.
Especially if you're not seeing any changes.
Yeah. And it's one of those that I think you could achieve just as good a result with a little bit more of a stronger intervention, which has less of a time drain, but that doesn't mean that it doesn't work. Dermaplaning's great at getting rid of that peach fuzz. When it comes to turning over the skin cells, which is another one of its benefits, you could get the same through an alpha hydroxy acid or a beta hydroxy acid topical. But yeah, it's great. If you've got peach fuzz, fine.
Do you recommend though for a person to do that themselves? Like all I can think about is nicking myself.
Yeah.
Yeah, it depends how experienced you are, and also whether you can disinfect the tools.
Yeah, good point.
You don't want bacteria festering on the scalpels and things.
Yeah.
Nope.
Just leave it up to the experts, right?
Yes, I think so.
Probably. Yeah.
Okay, so hot flash or hot take, change your skincare routine every few weeks to avoid your skin getting used to it.
Yes, with some ingredients. So there's only a few. So hot flash, hot take. They're so hard. It's hard. Because there are certain ingredients like hydroquinone that we know, and that's great for pigmentation, for minimizing the pigmentation within the skin. we know that your skin does get accustomed to that.
Oh,
So after every, 4 months or so, you might need to taper off and then restart again. It's the same with some acne medications, things like benzoyl peroxide. You wouldn't necessarily want to be on that long term. So there's certain ingredients that yes.
Okay.
Most no.
all right, good.
Most you can stick to your routine. The only thing that changes is maybe, I like to review someone's skincare plan regularly because the goals might have changed, their age might have changed, their
Hormones.
hormones, everything changes. So that's when we should be constantly tracking and tweaking as we go along. It should never be something that's set in stone. Oh, you're done for 10 years.
Right. Okay. The last one, I have a feeling I know which side you're going on this one, but I want to see. You don't need sunscreen if you're inside all day. Hot flash or hot take?
Hot. Bring the ice bags. So with this question, I get this a lot actually. Oh, I never leave the house. I'm never outside. So then I go through and I'm like, oh, okay, what happens? So you wake up and then what happens? And they're like, oh, well, I'll walk the dog. I'm like, oh, you walk the dog, do you? Where do you walk that dog? And do you walk it with, protection on? And I go, well, it's only 10 minutes. 10 minutes, it's going to add up.
Right.
And then they'll say, oh, and then I drive to work. I'm like, well, how do you drive to work? You're getting UV through the car window as you drive to work. Oh, do you go out for lunch or a coffee during the day? How do you drive home? So then I normally manage to figure out that they're not inside all day. And all those little bits of UV add up so significantly. Like that's probably an hour to an hour and 20 minutes a day without protection. That's significantly going to affect the skin.
Right.
That's probably the biggest cause of premature aging.
Is not wearing sunscreen.
Is UV damage.
Yeah. Okay.
Yeah. That's the overriding.
Yeah.
Sometimes I've seen people where the only intervention we've done is just got them to protect themselves with sunscreen and a hat, and they have different skin on the 3D camera.
Okay. Do you have a brand that you recommend?
I have a few
Or
different
SPF?
brands. I always tell people the golden rules are mineral, light, so not a moisturizing sunscreen. Ideally, a little bit of tint because it actually gives you more protection. It's nice for the skin.
Oh,
It doesn't have to
lovely.
be, but ideally a little bit of tint. Something that's not going to clog the pores, and good quality, factor 50. So the ones that I like are the Heliocare. I've got some Abaji ones in. So there's a few that I like, but as long as you tick those boxes, you'll be safe.
Okay.
All right.
Ooh.
That's what's on the list. Do you have anything else?
There is actually another question, only because I do get it probably on a daily basis or at least a couple times a week when I'm spray tanning women. And a lot of it is their focus on their neck. Because typically when I'm spray tanning, someone's always, they'll talk about themselves and they'll talk about like the newest thing that they're doing or like what's kind of going on. And the topic of their necks is very, very big in terms of, how to make it tighter, how to get rid of the lines and everything like that. Is there anything out there that can help that?
So again, the neck is a little bit similar to the under eyes, but a little bit worse in terms of the difficulty of treating it. When it comes to the neck, you have to throw everything at it, including the kitchen sink, because it relies 100% on skin condition. So it's like no other area of the face where we have so many other interventions, whereas that we have to focus on things like polynucleotides, lasers. We can do some Botox, but that's for the muscular kind of tightening. And even with those things, you get 30 to 35% improvement.
Okay.
The only really complete way to achieve what you want is a combination of skin conditioning and surgery, depending on the case.
Right.
But no non-surgical option will give you complete neck resolution. Oh, it's a bit of a depressing note to end on. Sorry.
Maybe there will be some things in March.
Yeah, well, exactly. March is approaching. Nobody panic.
It might be the year of the neck. We never know.
It might be. And not to say these things don't help. We've plenty of really happy clients where we treated their neck.
Yeah.
But I'm just realistic with
Yeah.
the beginning. You get a 30 to 35% improvement. And actually, that's quite significant. It's a third better than it was before.
Right.
It's just not perfect.
100%.
Okay.
Yeah. But that is a sensitive area. I think a lot of women are sensitive and concerned about their neck as they age.
Yeah.
And we can't really wear turtlenecks here. So
Cute stars.
cute scarves. There we go.
Yeah.
Your area. Well, thank you for joining us, Imogen.
Welcome.
That was so wonderful.
It's so much fun.
And I
Good.
think we'll have way more questions.
Oh,
We'll have to have you back again.
please do.
Tell us where people can find you, even though they probably know. But
Oh, definitely. So I'm at Aventus, with dental and facial aesthetics. It's Caribbean Plaza. So it's opposite Luca. We've got some flowers around our balcony.
yes, great.
Yeah, that's where I am.
What about on social media?
Oh, social media. Gosh. Let me think.
Dentist Cayman.
Oh, God, it's terrible.
We'll put it in the notes.
Terrible promotion for my scrub. Just
Go to Google.
I can find you under
Dr. Imogen came
I
in.
should really know that.
I can find you under Dr. Imogen.
Yeah, and actually, I do have my own sort of work Instagram, which is Dr. Imogen Cayman.
Yeah.
But we've got an Aventus page as well, so you can see some before and afters.
Yeah.
And actually, you guys should look out for us to start posting after our content day, so that you can see some of the real transformations that we're going to be doing. The participants are super excited, and I am too.
Yes. That's exciting.
got
I'm excited to see it. Good.
Perfect. Well, thank you very much.
Thank you.
Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!